What does a pharmacist do? Well, most people might answer that a pharmacist dispenses the medications that my doctor prescribes. Now, I work with a ton of great pharmacists, and one thing that I don't generally see is excitement about pills in a vial. And this is probably because pharmacists have been trained to do so much more. So what can you get excited about in your community? To find out, let's go beyond the scripts. Hey, welcome back to Beyond the Scripts. I'm your host, Will Tuft with PioneerRx. Today we have a very special guest joining us from Seattle, Washington. Someone who is part of an organization that has kind of transcended just community pharmacy and really become part of the fabric of that community in Seattle. It's hard to talk about healthcare in that community without mentioning Kelley-Ross Pharmacy. So Ryan, thanks for joining us. Tell me a little bit about yourself and what you do there at Kelley-Ross.
Thanks, Will. It's great to be here. My name's Ryan Oftebro. I'm a pharmacist and CEO here at Kelley-Ross Pharmacy Group. Kelley-Ross has been part of the Seattle community since it started in 1925 by Mr. Kelley and Mr. Ross. And so I grew up here. My dad's a pharmacist, and he had Kelley-Ross since I was little. He bought it in 1973. So I kind of grew up here dusting shelves and all the things that all of us with pharmacist dads did. And it wasn't necessarily something I wanted to do growing up, and kind of pursued some other things and figured out a little bit later in life that maybe dad was pretty smart after all.
I was going to ask about that because, I was reading up on Kelley-Ross and kind of the history there, and I didn't realize that you were second generation in that pharmacy. So on the history page, it kind of mentions that you joined in 2004 in a big way, but I didn't realize you had spent that much time, previous to that.
Previous to that, not doing pharmacy.
Oh, well, yeah. So I didn't realize you kind of grew up in the pharmacy itself there. So, which location was that? Because I know Kelley-Ross has a couple physical addresses there.
Yeah, we've got 4 locations now. They're all in Seattle. And the original pharmacy was downtown in the medical dental building. And at the time, in the 1920s, the medical dental building was kind of like the Mayo Clinic of the Pacific Northwest. So people came from all over, Washington, Alaska, to seek care. This is just sort of where all of the physicians practiced was in this building. So it's a pretty great place to have a pharmacy. So we were actually in that location when I joined Kelley-Ross. We moved shortly after I graduated from pharmacy school, about a block up the street, and we've since left that location, but we still have a presence kind of in the First Hill area where a lot of the health centers are, busy part of town.
Nice. Yeah. So, again, Kelley-Ross, like if you look at healthcare in Seattle, it's hard to not acknowledge the role that's played. And you guys fill a lot of different niches in that community. So You have your community pharmacies, but you guys also do adherence packaging, and LTC is a major component as well, right?
Yeah. So as I mentioned, we have 4 different pharmacies, and they're all very different in terms of what they do. I don't do a lot of traditional retail pharmacy. We have one primary community pharmacy location that's inside a busy clinic, not unlike what Kelley-Ross started as, in a large professional medical building. And so we're inside the polyclinic here on First Hill. There's about 125 providers in our building. And so we provide, traditional community pharmacy services, but that's also the location of a lot of our clinical services that we'll talk about. We have a compounding pharmacy. We do sterile and non-sterile compounding. We have a long-term care pharmacy. that is doing some really interesting work. Not only in kind of traditional aging populations, but we work with a lot of safety net organizations in the Seattle community, and have built some really fantastic relationships there with various groups that are, supporting our large homeless population as they transition into supportive housing. We have a large organization that we partner with that's serving the HIV community, people living with HIV and AIDS that have other comorbidities, a lot of behavioral health issues, a lot of housing instability, and that's kind of become our niche with our long-term care pharmacy.
I feel like Seattle has a pretty interesting population. It's such an interesting, eclectic place. Growing up as like a kid in the '90s, I have a special appreciation of Seattle's culture and the music scene that came out of Seattle that kind of shaped my whole generation. I feel like kind of has a soft spot for Seattle, even if you've never been there. So yeah, it is interesting that also kind of comes with its own set of social challenges as well.
Indeed, it's it is challenging, and we have just this huge spectrum of people in this community and in terms of socioeconomic status, and we see it here in the pharmacy, and we're serving some of the most wealthy people in the world, and their organizations, and then we are taking care of the most absolutely vulnerable parts of our population. And sometimes they're there in the pharmacy together, and we strive to make sure that everybody receives the best care that we can possibly provide. But it's definitely challenging, seeing just this drastic increase in our homeless population, and all of the challenges that come along with that. It's our city leaders have their work cut out for them.
Yeah, I'm sure. And right now during the COVID crisis, I'm sure that only compounds a lot of the challenges that you've already kind of faced. It's cool if you do some research. If you start Googling Kelley-Ross Pharmacy, you just find article after article about awards that you guys have won and efforts that you guys have really, invested in your community and put your best foot forward there. And there are so many different awards I could find on the social programs that you guys have and how you've reached out with, various programs. So it's pretty cool to see, that reach to the community.
Yeah. Well, thank you. It's, it's all about our team here. And just, we've got the most amazing people that have chosen to come work here at Kelley-Ross. Got a fantastic culture. It's very mission driven. Everybody is here because they believe in what we do. And, as a leader of the organization, that's very fulfilling because, I'm not the one coming up with all of these ideas at this stage. I'm just here to support, and, our team identifies a need or an opportunity, whether that's a clinical service or a way to engage with a community partner. If it's something they're passionate about, then my partners and I find ways to support it.
Yeah, for sure. So a couple of those things that you've really done to reach out in the community, I wanted to kind of touch on. One of those that I think is a really interesting challenge for Kelley-Ross specifically is the opioid epidemic. I read that in 2020, there were more people dying from overdoses than in any other year. And Seattle is definitely kind of, if you look at a heat map, there's definitely, a lot of action in that area, and King County and then the counties bordering, so what have you done to help combat that?
Yeah. Well, thank you for bringing that up. It's something that I'm particularly passionate about. And you're talking about a lot of the work that we've done to provide naloxone as take-home naloxone kits for anybody that wants one. The history of that is very personal. I lost a cousin to an opioid overdose, and that was in 2011. And that's kind of what got me started in this work. Was very fortunate to work with Caleb Bantagreen at the University of Washington, and we developed really the first of its kind, a collaborative drug therapy agreement to provide take-home naloxone to anybody that was at risk of an overdose or at risk of witnessing an overdose, and started offering these kits. And along with that, started creating training. We created some training videos that could be accessible and disseminated to anybody that needs to have one. I started doing a lot of presentations with parent support groups, and eventually developed a relationship with Seattle-King County Public Health. And that's when things have really taken off because this has been a priority for the county to address the rising overdose deaths. And so to this point, we've delivered thousands of take-home naloxone kits, both to individuals, to small groups, to larger organizations, and just finding ways to facilitate that, make it accessible, but also to provide that training education so people feel empowered to know how to respond to an overdose, because it can happen to anybody. And as you mentioned, overdoses, and it's not just Seattle, it's around the country, but they're up 30% this past year. So the COVID pandemic really exacerbated things.
Yeah, I think that's one of those social issues that even a couple of years ago, it seemed like it was a bit more removed, but I think most people have a firsthand experience with that. Someone in their family, someone they know, and even just a few years ago, I think naloxone was something that maybe was available from an EMS crew, but even the responding police officers may not have naloxone on hand.
Yeah, and it kind of goes to a lot of what we endeavor to do at Kelley-Ross. Like there's nothing more normal than walking into a pharmacy, and so trying to find some of these opportunities to take what would otherwise be a challenging healthcare interaction and bring it into community pharmacy and normalize it. And whether that's around providing naloxone or HIV prevention clinics, a lot of these things we just if we can remove that stigma and make it easy for people, it's good for pharmacy, it's good for the community, and it's a great opportunity.
Yeah. I think a lot of times that's kind of that lifeline that if you can be candid about it, if you can be open, if you can open those lines of communication, obviously there's other issues beyond the overdose that need to be addressed. But, I really feel like just having that communication and that like access to somebody who cares might be, at least a positive step forward at addressing those other issues.
Yeah. And what we learned from doing with this naloxone, it was unique in that, when we've tried to build other services, whatever they are, and any pharmacy owner has gone through this, it's knocking on a lot of doors and getting a lot of doors slammed in your face. Never ran into that with naloxone. Yeah. Everybody was willing to talk about it because, there's just this tremendous need. And so it was a really easy way to start new relationships with different community organizations. And that's led to a lot of other great things. But you're right. It's I think just normalizing that conversation, and pharmacists are great people to do that.
Yeah, absolutely. So the naloxone program, is that effective? I guess, fentanyl is a rising concern. And now in Seattle, you guys have the additional concern of carfentanil being introduced into the community. Is that still effective in those situations as well?
I don't know the right answer to that, Will. I know it's very concerning, and that there's concern that a naloxone kit may not be able to be adequate. But I think that it's still important to have one. It's like a fire extinguisher.
Yeah.
Just in case you need that there, in case of an emergency. But you're right. With a lot of these super potent synthetics, it's a whole new element to this epidemic.
Yeah, so it's definitely an important cause. Have you been able to fund that? Are you able to, monetize that? Or are you able to get help from the community to allow you to provide that service?
Yeah, that's a great question.
Unfortunately, there's always the financial side to talk about.
There is, and it's we're always looking to create sustainable services. The naloxone, I think part of it was just because it was so personal. It was important to me and important to my partners. It was something that we chose to do when there, wasn't really a lot of economic incentive to dispense Narcan kits. And, it's still a prescription drug at the end of the day. And when you're dealing with third-party insurance, that can be really challenging. And I think, between low reimbursement and, the time involved in educating somebody, there's not a whole lot of incentive for pharmacies to do this. So it's been part of our mission. We actually created a foundation, so the Kelley-Ross Foundation, with the sole purpose of helping support efforts like our Narcan campaign. And through that, we created with the University of Washington a training video that we've made available to anybody. And we've also done some short little videos on YouTube on, how to actually administer, whether it's the nasal spray, the IM injection, what have you. They're just little 30-second videos that our pharmacists put together. And we've made those available to anybody. So just trying to lower those barriers wherever we can for others. It's free. And the intent of these training videos is that anybody that watches it is considered trained and educated. So it takes that burden off the pharmacy to provide that time with the patient to do that additional training and education. So we want other pharmacies to use it. Go to stopoverdose.org, and that's the University of Washington's overdose prevention resource page. Some great resources there, including this training video that anybody who wants to get into this can use it. It's geared towards Washington State because we talk about the Good Samaritan law here in Washington State, but most states have some version of that, so it could certainly fill that role. But as far as monetizing it, that wasn't something that we set out to do. We've been fortunate to find partnerships with King County, where they're subsidizing a lot of these kits for organizations that aren't using third-party insurance. So that's where the relationship building comes in, and finding
absolutely
unique ways to think about the problems like these. It's been a passion project, and we have found some creative ways to sustain it over time.
Yeah. So I think in the past year or two, we've seen a lot of pharmacies kind of building those really, really strong relationships through COVID. But that same kind of partnership where you can identify that public health need and you can answer so many questions that, the state agencies have, that public, just the general public has. And so pharmacies can really step up and build those strong connections, even if, especially in the early days of, the COVID vaccinations and tests, it was kind of just like, yeah, the monetization's not really there yet, but it's what we need to do for the community. And it was, a dark time, obviously, in history, but, there are some shining lights of, pharmacy stepping up to the challenge. So how has COVID affected all of the programs and your patient base there in Seattle? I know yesterday we just reintroduced the mask mandates here in Louisiana. We're kind of sliding back into that. We're seeing that more and more across the country. How are things up there in the Seattle area?
I think they're probably consistent with everybody else's experience. It's seeming to be sliding backwards. But at least here in the Seattle area, we've had really good uptake with vaccination rates. And so, I think we're faring a little better in that sense, but yeah, it's still challenging. And as far as impact on all of our services, yeah, there was a period of time there in spring of 2020 where it was a challenging time, and I don't recall ever being as stressed out as I was in that 3-month period in March, April, May of last year, and just a lot of unknowns. And our community partners were all in the same situation, so it was just kind of taking it day by day. But it's interesting now that there seems to be a lot of pent up demand and energy to get things moving again. And so, where it felt like things were pretty stagnant for a long time, all of a sudden everything's off to the races, and lots of projects that are kicking off and lots of activity. So I think everyone's found ways to navigate things and move forward, and we're no different in that sense.
Yeah, I feel like Kelley-Ross maybe was in a unique position throughout the COVID pandemic to kind of fall back on some of those other tools you have in place. So like a lot of the LTC tools of, mail order and, shipping prescriptions, doing the unit dose packaging, were you able to kind of shift some of your efforts from retail into those channels, or?
Yeah, well, a big part of what we do now, particularly in our community pharmacy, is our clinical services. So I know we'll talk about how we got there, I'm sure, but a lot of our like our HIV prevention clinic, we had to pivot quickly, where we had been seeing patients in the pharmacy. We had a full panel of patients all day long. Suddenly not being able to see them in person. So having to quickly pivot to a telehealth platform. And I feel very fortunate that the team was already working on that for some other applications. And so it wasn't like we had to start from scratch. So we were pretty far along on having what we needed to switch to telehealth. So we were able to flip that switch pretty quickly. And we're able to sustain those services throughout all of the lockdown, which was pretty remarkable.
Yeah, it's been definitely a lot of adaptation everywhere. So it's it's neat to see how in different areas, different pharmacies have been able to meet the needs of their patient base. It is interesting that you guys are such in such a populated area, such a kind of a metro area. A lot of our pharmacies, independent pharmacies you see are, in smaller communities especially. So did you guys already have a delivery system in place, or? Yeah,
just, with our long-term care pharmacy, we already deliver all over the greater Seattle area daily.
Gotcha.
So we've got a team of 4 drivers, and they support our community pharmacy as well. they got a lot busier. So, and they were the guys on the front line that I'm so proud of our entire team, but our delivery team in particular were out there when people were not willing to leave their homes, and that was a scary time, and still is. But they really stepped up and made sure that everybody was taken care of, and I am really proud of their efforts.
That's awesome. That's awesome. I know that's a familiar challenge, for everybody for the past year and a half, I guess.
Yeah. So we were fortunate to have some of those pieces in place, but a lot of deliveries, a lot of mail, a lot of telehealth. Walking a lot of patients through technology that they'd never used before, in order to keep those lines of communication open, and just being very creative and adaptable and patient was the key.
Yeah, those lines of communication, incredibly important. And being able to keep those open through the pandemic, now things have opened up a little bit. If you're, if you are, if you have had your immunizations, I guess you are kind of seeing more face-to-face interactions. Are you providing immunizations now?
Yeah, we received, let's see, it was Friday, New Year's Eve, and we were all kind of winding down, getting ready for the holiday weekend when we received an email from the state that said your COVID vaccine order has shipped.
Oh, wow.
And we said, our what? So we somehow wound up with an entire case of Pfizer vaccine arriving the Tuesday after New Year's that we didn't know was coming. I mean, we'd said we wanted it, thinking, we just didn't think we were really going to get it, and so we had to spin things up quickly, and so we were giving COVID shots the next day, and again, that was just our team was just very nimble and very adaptive, and pivoted a lot of what they were already doing to spin up a immunization clinic that looked nothing like any of our previous immunization efforts, and did a phenomenal job. And to date, we've given over 12,000 shots. So we were pretty busy with that. Yeah.
That's a huge impact. That's a lot.
Yeah, it was a lot, but of course, very rewarding. Just seeing the way that everybody pulled together, and again, just very mission driven, and they kept coming up with ideas and ways to adapt, and we were able to implement them quickly. And even that first weekend, we were running a mass vaccine clinic out of one of our locations for all the area healthcare providers that needed shots. So, and what was really special about that was that we quickly realized we're going to need a lot of people to staff these mass vaccination clinics. And within a matter of a couple of days, I had volunteers from pharmacies all over town, including Bev at Caterman's. One of her pharmacists came in and helped with the effort, and that was one of my proudest professional moments. Was just being able to put together this clinic quickly for healthcare providers, staffed by pharmacists from all over the place, from independent, from chains, you name it. They came and they helped support this, and it was really amazing, and really a special moment for me in my pharmacy career.
That's so great, man. Love to hear Beverly Schaefer was involved. I know she's kind of a legend there in the independent pharmacy world, and definitely a big advocate for provider status in the area, which I'm sure has been something that you've been able to leverage with your clinical programs there. So tell me a little bit about the clinical side, some of the things you guys are doing. I know your PrEP program especially is super interesting, but you guys have a lot of irons in that fire.
Yeah. Well, again, and you mentioned Bev, and she's just been such a champion around provider status and expanding the role of pharmacists. And we've got a lot of just phenomenal people that have done a ton of great work over the years to get us to the point that we're at now. And so in 2017, a law in Washington State went into effect that allows community pharmacists to basically participate in medical billing for any clinical services. So it's that provider status that we'd all been seeking. We finally had that mechanism to do it, and so we jumped on it and went through the credentialing and contracting process, and were able to contract with a number of the large commercial health plans in the area. And we'd already started our PrEP clinic, and it was kind of a different model from what it is today, and we adapted it around this opportunity with provider status billing. And so our PrEP clinic is unique. It's a pharmacist-driven clinic, and it actually started as a residency project. We have a community residency program, and our resident and one of our clinical pharmacists came up with this concept of providing PrEP. And this was at a time when nobody was doing PrEP. Nice. They pitched it to us as a concept for a project, and sounded amazing. So we ran with it. And so it's all pharmacist driven. Everything happens in the pharmacy. So somebody interested in HIV prevention, they schedule an appointment, and they come in and meet with the pharmacist. We do all of their labs in the pharmacy. And if appropriate, they're initiated on PrEP. And all of this happens in one visit in about an hour. So we call it one-step PrEP. It's one of those things that we've just been able to find ways to remove all of the barriers to patient access and make it really easy for people. And it's been absolutely phenomenal. And it's grown to the point now that we're actually able to bill for our time and not worry about the reimbursement on the product, that it is fully self-sustaining, and we're actually building and expanding out just clinical services at this point, because we've got a model that works. So it is possible.
That is so cool, man, because that's like really the ideal scenario. I know so many pharmacies across the country would just, are saying, see, this could work. We can take so much burden off of the healthcare system. We can move that burden over here. Pharmacists are trained to do that. We have those connections in the community. Put me in, coach. But up there in Seattle, you guys have been able to really take that model. So if anybody outside of the world of pharmacy is watching this podcast, they may not realize that pharmacists, even though they're trained in a lot of states, a lot of areas, can't use their training to provide those services that they could provide so well. And even when you have pharmacies that do, a lot of times they're offering those services and not being reimbursed for them. So, it's really like the pinnacle of that, operating at the top of your license, where you're performing those labs, you're taking those clinical results and documenting, e-care planning, providing the prescriptions that accompany that use case. And then, really it's like you said, that one-stop shop. So I guess two-part question, where do you see that moving forward in your community? I know there's some other areas that you can apply that, but then, what do you think the holdup is in other states that haven't granted that provider status?
Yeah, well, as far as other states go, I know there have been a lot of great efforts around the country, and other states are starting to see some progress there. And I know there's a handful of other states now that have similar laws on the books. So I think we've got some good model legislation out there now. So it's just a function of staying engaged with your legislative efforts, and partnering with organizations that are going to support that messaging. We had great partners in the schools of pharmacy here in Washington State, and the Washington State Pharmacy Association really led that charge. But supporting those efforts, supporting your professional organizations so they can get that work done. But it's coming. It's not coming as fast as it should, but we're getting there. And I think we've got some really good examples of how we can provide collaborative services to our community that improve outcomes, reduce costs. And as far as where we're going with this, it's always a great question. But there's we're still putting energy into prep, but I think there's just again working with public health. I think there's so many opportunities where we can do things that are collaborative, that are going to engender the support of the healthcare community. So hepatitis C is kind of our next big effort. And I'm still very much interested in overdose prevention efforts. So with some of the populations that we work with, all of these things are sort of coalescing. And so we're trying to figure out, okay, how can we take what we do and take it out further into the community? So we're working with, again, I mentioned, some of the local organizations here that are providing supportive housing as they transition people from homelessness into supportive housing that have some form of integrated health care, taking our pharmacists and embedding their services within these organizations to kind of expand our reach and expand the offerings that we're providing in the pharmacy, taking it to the point of need. So that's kind of my vision for where some of this is headed. But it's I think there's plenty of opportunities out there, but you have to be willing to look in non-traditional places to find them, I think.
Yeah, absolutely. I think you're right on there where, when you look at a lot of these problems, they do kind of compound on each other sometimes, and being there in the community, treating those, those root causes, those social determinants that are going to lead to other challenges is really the key. And I think, like you said too, once you have other states who are looking at legislation, having those successful use cases, saying Kelley-Ross can do it, here's the difference it made in their community, So are you able to work with any of your, local governing bodies and show them the fruits of your efforts and kind of say, here's where the rubber meets the road, and here are some statistics on how we've made that positive change?
Yeah, it's all about the data at the end of the day, isn't it? We've done that. We've done that both with our some of our naloxone efforts, and again, that's where some of those partnerships really come into play, because public health really has an interest in these issues, and they they often have the resources to do that. We work very closely with the University of Washington School of Pharmacy. We're all my partners and I are all alums. We have a lot of UW pharmacists here, and we're preceptors. So we do a lot of training. So having that close organization with School of Pharmacy, I think has helped with some of those efforts. But you're right. You've got to be able to prove that what you're doing really does make an impact, and finding ways to track that and present it is key.
Another thing that you've done outside of the PrEP program is really just focusing on medication coaching. So again, taking that, beyond medication, but really understanding and lifestyle changes. So how have you kind of seen that work out in your community?
Yeah, well, I mean, I think that's something that all pharmacists are endeavoring to do in one form or another. And again, we try and find novel ways to do that. And one program that I think is really remarkable has come through a relationship with our area agency on aging, Seattle Aging and Disabilities. And this has been a relationship we've been developing, I think, since I was in pharmacy school. And it started with a case manager calling up and asking me if we could do Medisets. And I'm like, yeah, we do Medisets. And like, oh, could you do them in this situation? I'm like, yeah, we could do that. And we'll deliver it. And, it started as simple enough, but it's grown and evolved into something completely different, where it has nothing to, we actually don't dispense any medications for clients that we're partnered with through aging and disabilities, but we've contracted with King County to provide what's called the Senior Drug Education Program. And so pre-COVID, a pharmacist would actually go out to should be assigned buildings that were operated by this group. And it might be SHAG is one of them, but there's, every community has something like this.
Sure.
But we're able to contract to cover the pharmacist's time to go out and provide group coaching around medication-related issues, fall prevention, you name it, all of those topics that pharmacists are experts at, and provide classes as well as one-on-one coaching, medication reviews, and doing all these off-site at these different buildings has been very well received, and we know it's making an impact, and we've been able to figure out a way to sustain that over time. That was another one that we had to pivot during the pandemic and figure out how to do all of this stuff remotely. And again, that's where that, helping educate seniors on how to use some of this technology was challenging, but
Sure.
Finding ways to make that happen. So yeah, that's I think that's one example of how we've been able to take that traditional medication coaching concept, take it into the patient's home, where they're most comfortable to receive that information. And you learn a lot more as a provider when you can meet somebody on their terms, and I think you can have a bigger impact when you can see how they live. They're more comfortable talking to you about their medication challenges, and at the end of the day, you can have a better interaction.
Oh yeah, just having somebody there where that person is at every day, you may pick up on so many pieces of information, so many pieces of the puzzle that you just couldn't have seen otherwise. I love there's one of the early podcasts we had Joe Williams who talked about the difficulty in just getting in and out of their driveway because there's a limb that needed to be cut down. So, this is a small community adaptation, but he showed up with a chainsaw, and took that limb down for him. But, those are the kind of things that you really can't see. Is there like a, medication storage issue? Is there a slip or a step or, all of those things are just hard to really understand if you're not there where they're at.
Yep, exactly.
So in 2022, 2021, we see things hopefully returning to normal a little bit with the rise of people who have been fully immunized. Where do you see Kelley-Ross going? What have you been dying to do that has had to be backburnered, or what opportunities? What's next up once the you have the green light?
Been dying to take some time off. A great question. 2022 is already looking like it's going to be pretty busy, and I mentioned a lot of that pent up energy in the community. I think a lot of the groups that we work with as community partners, they're ready to grow. And so, our goal is to grow with them. So we're already looking at expanding, as I mentioned, with kind of trying to embed some of these services in the community, and grow our clinical services. So we're looking at a couple of opportunities right now to take what our clinical pharmacists are doing and replicate that inside other organizations. So that's kind of our focus right now.
Nice. Well, hopefully things will cooperate and take a vacation. I saw your bio mention that you like to get out and enjoy the Pacific Northwest and go out and hike and everything. I love it up there. What do I need to do next time I'm in the area? What's your go-to up there?
All right. Yeah. Well, so we're surrounded by a lot of water. That's kind of my go-to. And we've got a little family cabin up on Whidbey Island. So I try and get up there whenever we can with the family, and it's just beautiful. There's lots of crabbing right now, whale watching, all that good stuff. And it's just it's a quiet, relaxing place. I enjoy that. But now you can't beat the Pacific Northwest. We've got hiking, skiing, all the things. So just try and enjoy that whenever I can.
Yeah, any chance I have to make it up there, I'm always just like, yes. It's so amazing up there. All right, well, hopefully you'll be able to carve out some time for that here in the upcoming months. I'm going to let you get back to it in Kelley-Ross Pharmacy today, but thanks so much for joining us.
Thanks, Will. It was my pleasure.
All right, we'll have you on soon again, hopefully.
Okay, thanks a lot.
Thank you for listening to this episode of Beyond the Scripts, presented by the Catalyst Pharmacy Podcast. If you enjoyed this episode, please support our channel by liking, subscribing, and clicking the notification bell so that you'll be notified anytime we post new content. To stay up to date with all of the latest independent pharmacy news and content, follow PioneerRx on your preferred social media platform.